there's a good compromise, and that is what?
And we're talking predominantly about the physician ownership and where we've been able to joint venture with physicians and keeping that model, which right now the bill would try to eliminate. And what we would like to see is that those facilities and organizations that have found this to be a very positive strategy, that they would be allowed to continue. There would be a grandfathering, if you will, clause in there, and also that the date of the grandfathering would be simultaneous with the bill whenever it's enacted. There's been efforts to continue to kill physician ownership and joint ventures, which goes exactly opposite of where healthcare should go in the future with physician alignment around the quality and safety. And also allow those that are already existing, it's not just in the state of Texas, there are many states that have these ventures, is that they would be able to also continue to grow those, because what the bill wants to do is stop the ability to grow it. And that takes away the private, I believe, approach to how we can deliver care in a higher quality level and more efficiently and safely.
Thank you.
I want to ask Mr. McBride just some technical questions. Your plan in Lubbock, is it called a pool or a co-op or a co-op pool? What's the technical term?
It is called a private nonprofit co-op.
Private nonprofit. Who can join?
Any Chamber of Commerce member, you have to be a member of the Chamber of Commerce first, and then anybody that has a...
Anybody who works, if a chamber member joins, then the employees of that member can participate.
That is correct, yes sir. A minimum of 2 employees it takes to...
Who makes the decision, the employer or the employee?
The employers.
Okay. So an employer could mandate that everybody in his or her company participates in the pool as opposed to having private insurance or maybe a different regular plan, Blue Cross Blue Shield or something like that?
Yes sir, it takes a minimum of 75% of the employees in that particular business to be able to enroll into the
How do you cover pre-existing conditions if an employee has is a diabetic, or let's say has a heart condition, or let's say an employee has cancer? How does that?
The initial enrollment for our plan had no pre-existing conditions. So the initial, when we started 4 years ago, the underwriting was not a problem, so there was no pre-existing conditions taken into consideration for enrollment into this plan for the first 2 years.
And my last question on that is, in terms of market penetration, what % of the health insurance market does the co-op plan have in the Lubbock area, people who could participate? You have half the market, 30% of the market?
I don't really know that answer. It's probably less than 20% of the market, I would imagine.
Thank you.
Sure. Let me ask you a follow-up, if I may. How many insurance options do chamber members have when they select your health care?
There are 7 different plan designs that are available to the businesses when they sign up as a group.
What are they?
There's 4. There's 2. There's an HMO, there's a PPO, there's an HMO with an HSA lookalike, and then there's a catastrophic hospitalization coverage.
Yeah, and I think people don't realize that HSAs would be outlawed under this plan in 30%.
Yes, sir.
I'm going to ask Dr. Crow a question. Would you consider...
Can you all hear the congressman? Would you all speak into the microphone?
I'm going to ask Dr. Crow a question. Is the concept that you just talked about, would that be in the vernacular in medical homes? Is that what you're providing?
Yes, sir, it is. We'd probably be a little bit more than a medical home. We'd probably use the village.
Okay.
Because medical homes, so far, if you talk about medical homes in the national jargon, it really does include the primary care physician using a team of paraprofessionals to coordinate care. This is taking it at one step further.
Do you take Medicare patients?
Yes, sir, we do.
Do you take Medicaid patients?
No, sir, we don't.
You don't take Medicaid. What about self-pay, people that don't have insurance?
About 10% of our, we are the cheapest game in town, much better than going to emergency room.
Okay, but if somebody joins your village, then you sit down with them and you give them a point of contact, a primary care, and depending on that person, it could be a general family physician, it could be a cardiologist, it could be depending on their medical condition, that's who their initial contact point is that correct?
Primary care physician would be their initial.
Their primary care is always the initial. Even if you had somebody with a smoker and had 2 heart attacks and lung cancer, they would still go to their primary care.
For the coordination of care to make sure that the pulmonologist, cardiologist, and oncologist are all speaking to each other and have a single source for all their information.
And my final question is, why do you take Medicare but not Medicaid?
Medicare doesn't cover our costs, but we allow our patients to mature into that. I mean, there are people that we've had relationships for a long time, and as a family physician, that's what you kind of go into it for. You're not going into it for the money, you're going into it for the relationships. Medicaid, fortunately in Collin County, is a very small percentage. So 2 things. One is it's about half of what general insurance pays us, and secondly, we actually support the Collin County Children's Facility. We staff the entire free program at the child to kind of make up for that fact and help over there, because that is where they see all the Medicaid patients for the most part in Collin County.
Okay, thank you.
Yeah, I'll direct this to Mr. Allison, but anybody who wants to speak up. I was taken by your comment about, kind of paraphrasing you, that we need to also recognize or celebrate all the good things in our American healthcare system. And not unlike my colleagues, I've probably had a dozen different town hall meetings, live, on the telephone. Anybody can come, doctor. So I've spent a lot of time talking to people over the month of August. And I agree with what I hear in the national polls, and that is probably 75 to 80% of Americans are happy with their health care, but for the affordability and the portability. So I think many in this room agree that portability, if we had the political will, is fairly easy to solve, and that is give the same tax benefit to the employee you give to the employer, let them go into the market. Let's speak about affordability for a moment. At least from what I hear in the research I've done, 2 of the great cost drivers are still defensive medicine, having to do with medical liability reform, and state and federal mandates. With respect to defensive medicine, I've probably met with 70, 80 doctors in town hall meetings over the last month. And I ask them, how much defensive medicine do you practice? Not a scientific survey. But overwhelmingly, I would say the average is 1/4 to 1/3 of the medicine they practice they consider to be totally unnecessary. But for fear of litigation, they order the test. And so as someone who's experienced in running a hospital system, does that ballpark figure sound about right? And if we rolled out the Texas liability reform law nationwide, what impact might it have on the affordability question?
The couple of comments I'd make on that. One, you're exactly right. Tort reform does have an impact, and it's something that we would want to see on a national basis. We think it should be necessary. And we have seen, in our situation, the cost of our professional liability insurance go down because we have tort reform in Texas. But more importantly, as our physician partner seen it, what people don't recognize is in the state of Texas, we were losing physicians because of the liability crisis.
I understand we have 30% more who have come to Texas since that law was passed.
They have come back to Texas, many others have moved. Obstetricians, we were losing neurosurgeons who wouldn't cover the trauma centers, and people were going without access to care because of that liability. And so the tort reform not only is helping bring down costs, but it's bringing physicians back, which were sorely needed because we still have a shortage of physicians in Texas.
Yeah, we're ready. If you all have any other questions you want to ask, or you want to hear from the audience?
Audience.
Well, I just